How a complex Medicare Advantage market left Humana scrambling to start 2024. Humana has had a rough start to 2024. Shares of the insurance giant are trading near a 4-year low after the company reported a surprise loss in the fourth quarter of 23 due to higher usage in its Medicare Advantage business. Humana said costs in this segment will remain elevated through the end of the year. Humana, one of the largest providers of Medicare Advantage plans in the US, recently reported a surprise loss in the fourth quarter of 2023. This was due to higher than expected costs in its Medicare Advantage business. The company also said that costs will remain elevated through the end of 2024. But before we get into the details, if you have not done so already, please click the like button below, and also don't forget to squeeze the subscribe button. It'll only take you a few seconds, but it will help the algorithm so that you don't miss out on our content. It will also encourage us to create more content for you, and we truly appreciate your support. After years of delayed care during the COVID-19 pandemic, older Americans unleashed a flood of pent-up healthcare demand, starting in late 2023. Postponed procedures and treatments surged, overwhelming Humana's ability to accurately predict costs. The result was a sharp rise in Humana's medical loss ratio. This ratio, if you're not aware, represents the percentage of insurance premiums that are paid out in claims. Humana reported a 91.4% ratio in Q4 2023, far above the initially expected 80 to 85% target. The Medicare Advantage sector is navigating a complex and dynamic period of change as we are all working through significant regulatory changes while also absorbing unprecedented increases in medical cost trends. The increase in utilization that emerged late in the fourth quarter was a significant deviation from an already elevated level, impacting the industry. The company now expects adjusted earnings in 2024 to reach $16 per share, down from $26.09 in 2023. Humana's 2025 earnings forecast now stands at $22 to $26 per share, whereas as of November of 2023, the company had expected to earn $37 per share in 2025. Analysts blame the complex and rapidly changing nature of the Medicare Advantage industry. Regulation, demographics, and utilization patterns are all shifting simultaneously. This makes forecasting treacherous. Following its earnings and the earnings report on Thursday, Humana stock fell 12%. Earlier this month, shares had fallen 12% after pre-announcing these downbeat fourth quarter results. Over the last year, the stock is down nearly 28%, while the S&P 500 in the same time period has gained over 20% during the same time period. A surge in usage in the Medicare Advantage segment has been one of the things that has been discussed. Typically, this Medicare Advantage segment has been a highly profitable market and has been criticized for realizing these profits at the expense of the taxpayers and seniors. Medicare Advantage was first created in 2003 through legislation. It is supposed to be a more efficient and sometimes cheaper alternative to supplemental Medicare plans known as Medigap. Since 2003, established health insurers and startups alike have oscillated in and out of the market. According to KFF data, which is the independent source for health policy research, polling, and news, about 51% of eligible Medicare beneficiaries enrolled in a Medicare Advantage plan last year. So, changes in utilization rates, payments from the federal government, and changing demographics all contributed to Humana's woes in 2023. Primarily, a rise in older patients seeking care resulted in higher than expected costs late last year. The company's benefits expense ratio, or medical loss ratio, MLR, hit 91.4% during the fourth quarter in its insurance segment. Analysts had expected this ratio to come in closer to 89.5% during Humana's fourth quarter. MLR is the share of premiums an insurer pays out towards care. In the same quarter last year, Humana reported a benefits expense ratio of 87.4% for this segment. The Affordable Care Act mandates that companies have an MLR of at least 80 to 85% each year. And companies like to stay on the lower end of that range. But Humana expects it will stay in the 90% range for 2024. Humana's fortunes are also heavily dependent on Medicare Advantage compared to rivals. Over 70% of Humana's revenues stem from individual Medicare Advantage enrollments versus less than 50% for the industry leader United Health. United Health Group, which has the highest share of Medicare Advantage membership amongst all the market's major players, said it is adjusting to lower reimbursements from the Biden administration and is ready to manage the pressure of higher expenses. Humana ranks second amongst Medicare Advantage plans with about 18% of the total market share. United, by comparison, has 29%. According to KFF data, CVS through Aetna has 11% and Centene Corporation, once a Medicare Advantage giant, has just 4%. Cigna serves just 2% of the Medicare Advantage market. But Humana's fortunes are far more tied to the Medicare Advantage business than that of its other rivals. Take United Health, for example, which brought in $113 billion in revenue from its Medicare and retirement segment in 2022, accounting for about 45% of the company's total annual revenue. Humana, for its part, saw 81% of its annual revenue come from its Medicare segment in 2022 and over 70% from individual enrollment in the Medicare Advantage plan. Humana has tried for the past several years to merge or to be acquired. In its first attempt, it tried to merge with Aetna in 2015 before a Justice Department ruling scuttled the proposal in 2017. Aetna later merged with CVS in 2018. More recently, Cigna had sought to acquire Humana before talks broke down. Matter of fact, I have a video on that, and I will put a link in the description so you can see the details of that transaction there. Now, the pressure Humana is facing is also similar to the story for Centene, which recently laid off workers and is expecting further negative impact from the changed star ratings criteria. On the other hand, the pressure Humana and others in Medicare Advantage market are facing could also be short-lived as the whole industry reacts to the surge in usage seen starting in late 2023. On the other hand, enrollment growth in Medicare Advantage plans going forward may not be as explosive as it once was, as demographic forces or the silver tsunami that once made this market boom start to fade. Data from the Census Bureau projects the US population 65 and older to grow from 56.1 million by the end of this decade. Next decade, however, the rate of growth amongst this demographic is expected to slow down, with the Census Bureau projecting that 80.8 million Americans will be over 65 by 2040. In a rapidly maturing market with many shifting variables, Humana has flashed a warning signal to the entire Medicare Advantage industry. The company's questionable grip on cost forecasts and reliance on individual enrollments has left it dangerously exposed to industry changes. With demographic and regulatory tailwinds dissipating, firms like Humana will have to skillfully reorient themselves to prosper in an increasingly treacherous market orbit. For an industry that has historically enjoyed a smooth sailing, some inevitable turbulence awaits. I'd like to hear your opinions on what you think about this. Even if you disagree with my thoughts, please comment and let me know what you think of the issue and the state of healthcare insurance and coverage and healthcare in general in the US. As always, thank you for watching. And if you haven't clicked the like button, please click it and also squeeze the subscribe button. And I will see you in the next video. Thank you for watching.